The following portion of Live at 9 is sponsored by Memphis Vascular Center. And joining me now is Dr. Layman, an interventional radiologist. And today you're talking about
pelvic venous disease.
And what is that?
So pelvic venous disease is one of the causes for women to have chronic pelvic pain. And that's basically non-cyclical pain, so not related necessarily to their cycle, that's lasting for at least 6 months. It can get worse during their cycle, but it's a more long-term etiology.
What type of pain are we feeling?
So usually women will complain about a heaviness or ache that's deep in their pelvis that usually gets worse as the time progresses, and really that's just because gravity, the veins are having to fight to get the blood out. Blood is pooling in the pelvis, and it's usually worse at the end of the day. Sometimes it can be worse after a long period of standing, and also after physical activity, and that can even include intercourse.
Okay, and then is this a common disease?
So chronic pelvic pain in women is a very common issue. When that being secondary to the blood not getting out with venous issues, it's a very common etiology for it. Yeah.
Okay, and when it comes to diagnosing it, is there a challenge to diagnose this?
It can be. Usually women are coming to us after kind of a long process, either at their primary care provider or with their gynecologist. And usually they've been treated for a variety of issues, and it's kind of become a diagnosis of exclusion. Mm-hmm. Usually women are coming to us and they'll have had some form of either a pelvic ultrasound or cross-sectional imaging where we can see the veins are dilated going down to the ovaries and to the uterus.
Okay, and what kind of treatment is available for this?
So oftentimes women at this point will have gone medical treatment either for a variety of issues that they can be causing pelvic pain, but treatment options would basically be either hysterectomy as the surgical option or what we offer, which is actually shutting down the vein going down to where it's refluxing.
And what type of recovery when it comes to your guys' way?
Sure. It's generally pretty quick. Usually the procedure will last anywhere from about 30 to 45 minutes to get down and shut down those veins and stop the blood refluxing. We'll watch folks for about an hour, maybe two afterwards. And then generally the recovery is pretty quick. They'll have to take it easy that day and maybe the next. But generally folks recover very quickly with minimal side effects.
Who's a good candidate for that type of a treatment?
Sure. It's usually women where we have, they've gone through a variety of treatment options, they've discussed it with the other providers, and then we're seeing that cross-sectional imaging and showing those dilated veins, whether it's a CT or an ultrasound, but also they have those dilated veins and certainly pain that have been prolonged for them, unfortunately.
Okay. How can viewers get in touch with you?
Yeah, sure. You can reach out to us at Memphis Vascular Center. Our contact information is there, and schedule an appointment.
Well, thank you so much. Greatly appreciate
Absolutely.
the information.
Yes, ma'am.
Well, the preceding portion of Live at 9 was sponsored by Memphis Vascular Center.